Earlier in the show, Joe Dana looked into both sides of the vaccine debate in this country. Statistics show that more and more kids across the country and here in Arizona are going to school without being vaccinated against some very dangerous stuff. Measles, smallpox, MMR, polio, just to name a few. Tonight, we've invited Will Humble, the executive director of the Arizona Public Health Association, down to talk not only about childhood vaccinations, but also the COVID vaccine, which right now is hard for some people to get. Will, good to see you.
Yeah, thanks for the opportunity.
I think that both of us would agree as parents that we should always have the right to not vaccinate our kids. Where I think it gets sticky is when that unvaccinated kid goes to school. So how valid is the argument from parents who say, I don't want my kids exposed to dangerous or deadly diseases just because you don't want to vaccinate your kid?
No, that's you get right to the core of what vaccines are all about, which is the vaccine that I get and I take is the vaccine that protects you during this interview because I'm not going to infect you.
Right.
It's that on a much bigger scale in classrooms because you see what the conditions are like in these classes. They're really crowded.
Yeah.
It's real easy for a disease like measles to spread really quickly, and we're seeing that. There's a big outbreak in Colorado City in Arizona. There was an early one up in the White Mountains. And so the way you approach it and the way we've approached it for decades is to get as many people vaccinated as possible.
So you get the herd immunity.
So you get the herd immunity so that the entire classroom is safe. And as you mentioned at the beginning, there's a personal exemption. So for people who just like, I am not vaccinating my kid, you don't have to. But the vaccine requirements that the state health department has and that the schools, when you check them in the fall, they look to see those certificates to make sure they're vaccinated. The purpose behind that is to keep the kids healthy so that outbreaks don't happen, so you don't have to send the unvaccinated kids home. Because that's what happens. If there's an outbreak in a school, the public health department goes out there and said, okay, these are the cohort of unvaccinated people in this school. You need to stay home for 21 days, 2 incubation periods, because they are at risk for making this spread quickly. So the purpose behind it all is to keep the kids healthy, keep them in school so that they don't get sent home and don't infect other people.
I think one of the arguments that I hear a lot from people that don't believe in vaccines is the autism issue. Do we have any hard scientific empirical evidence that these vaccines can cause autism?
No, none. And it's been enormous what are called observational studies, both here and in Europe, other places, mostly in Europe and the United States, that look at this issue in extreme depth and systematic reviews. So studies of studies, all of them none of them have ever found any link between autism and vaccines. Now, if you listen to Secretary Kennedy, he'll say stuff, but he has no data to support that. These are enormous studies with huge numbers of participants with lots of statistical power.
Why do you think then these parents are so dug in on, I am not going to vaccinate my kid against whatever it is because I don't want them getting autism? How does this gain such traction?
Well, I think in some sense, it's a loss of trust in institutions, which has been a systemic thing throughout society, not just a health thing, but across the board about pretty much any public policy issue you can think of.
Sure.
And so when people stop trusting experts and institutions and studies and believe conspiracy theories that they can get at whenever they like on Facebook and places, it creates a cohort of people that don't want to believe anything. The one group of people that most people trust are their pediatricians because it's a one-on-one relationship. And so they're really the ones on the front lines and it's a lot of work to get a non-vax parent to start vaccinating their kids. But they're the ones who are really doing all that.
And I think one of the reasons I wanted to have you down here is because there is a feeling that a lot of the red states are going to take Florida's lead and do away with mandatory vaccine mandates. What does that look like if that happens here?
Well, if that would happen here, it's not like something that happens immediately, but you're putting yourself at risk more and more as each year goes by. you're putting yourself at more and more risk that, especially measles, which is it's the most contagious, that's the first one that we're going to start to see circulating more and more. And then there'll be German measles, mumps, those sorts of illnesses that were commonplace when I was a kid. I was born in 1960. That first MMR vaccine came out in 1962. And I can tell you, my mom still talks about how scared she was because I had a 105-degree fever. She thought I was going to die.
Well, I'm older than you, and I remember when polio was a common thing. And every parent that I knew of or could remember was marching their kid in to get that polio shot.
But that goes into the question you asked a few minutes ago, which is, why is this happening? Part of it's the loss of trust in institutions and experts. Part of it is the loss of feeling like these viruses are a threat because the stories are leaving. Like, the people that could tell their stories are people like my mom, who she could tell you what measles and how scary it was. And because the vaccine came in 1960, the people who are becoming grandparents today were in the post-vaccine era. And so they didn't feel the immediate threat to the virus. And so the vaccine becomes maybe that's the threat because this virus isn't a threat. Well, it's not a threat because we got herd immunity by doing vaccination over those decades.
Before I let you go, I have to ask you about COVID because I know that the committee is meeting in Atlanta this week.
Yeah.
What do you think will come out of that meeting?
I think they will put some restrictions on who can get the COVID-19 vaccine booster. I think they'll probably limit it to people 65 and over, and then for people 64 and under, that they may put a stipulation that it requires a prescription. And that's why Governor Hobbs's executive order is so important, because it charges the state health department with putting together what's called a standing order, which would essentially be that prescription that would allow pharmacists to then administer the vaccine in clinics. And so Hobbs she's trying to do a workaround, anticipating what the committee is going to do on the 18th and 19th. I'm certain they're going to limit access to this vaccine.
I must be an idiot because, to me, from where I sit, it should be no different than the flu vaccine. If I want to protect myself against the flu, it's the easiest thing in the world to do. I go in a drugstore, I go to my doctor's office, I get the flu shot. Why wouldn't COVID be the same?
Right, it should be. And it would have been, except Secretary Kennedy got rid of the committee and put in some people that are mostly anti-vax, not every single one of them, but the majority are anti-vax, and some are just wellness influencers, and they don't believe in vaccines. And here's the thing, that I feel like when they passed the Affordable Care Act and hardwired this advisory committee for immunization practices into the Affordable Care Act, I don't think they ever anticipated that we would have gotten to the point that we are, where this committee is stacked full of people who don't believe in vaccines. I mean, I would have never thought that would happen in 2010, 2011. And that's where we are. And that's why the committee is who it is. And it's hardwired into policy, because this is the other thing, we haven't talked about this. I don't know if we have time, we have to cut it, but insurance companies don't have to cover vaccines that aren't recommended by the Advisory Committee for Immunization Practices. That's hardwired into the Affordable Care Act. So when this committee meets at the end of the week, it's not just where you can get the vaccine, but how can you pay for it? And we're at real risk of, for people under 64, not being able to, even if you can get someone to administer it, they're going to have to pay cash for it. But that's another thing that the Hobbs's executive order does, is it's a workaround to try to encourage or twist the arms, I guess I would say, of the health plans to ensure that they continue to cover the vaccine even for people under 64.
Will, good to see you. Thanks for coming in. It's a great topic. It's an interesting topic. Everybody has an opinion on it. So the bottom line to that is I'm sure we'll talk again.
Okay.
Will, good to see you.
My pleasure.
All right, great discussion, guys.